Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Good evening and welcome to today's weekend word round. Today it's Saturday, the 8th day of May 2021, and Snowspirations Global Health Solutions is a global provider of maternal and child health related issues. So this evening, in regards to our weekend word round, it will be an opportunity for you to ask me questions directly. Then I'll provide you feedbacks. So it's going to be an open clinic. It's going to be an open interactive clinic. So you ask me questions. So every weekend, we have kind of an overview of everything we've done over the weekend, over the week. So from today till next Friday, if you have any concerns, if you have any questions, if you have any issues, if you have any worries, this is an opportunity to get feedbacks from me directly. Now, remember, we have different platforms you can join to participate. So if you're my friend in Facebook, if you're in my timeline, you can see me right now live. If you're in our group, you can see me there live. If you're in our page, you can also see me there live. Then we are also in YouTube. Now, the number in YouTube, it's not encouraging yet. And this is exactly where you can do things outside Facebook platform. So I will strongly encourage you to join our YouTube channel. What you need to do is to click on the link. Once you click on the link, you're good to go. Admin is going to quickly show up and they will share the platform. They will share concerns. They will share different, platforms you can use to join. So the links to join the group will be shared. The links to join the page will be shared. The links to subscribe to YouTube will also be shared. These are your opportunities. These are avenues you can use to ask me questions. Now, when you come in, please confirm you can see me. I can see about 38 people are joining. So what I want you to do is to type in your questions, and I can quickly see who is in attendance. And please, when you come in, let me know your location. I love the number 50. So 50, it's my number. So once I have 50, I'm going to open the clinic. You will have opportunity to ask me questions. But please, when you come in, let me know who you are. Tell me your name. Chudi Ufondu. I'm the convener of the group, and I live in Florida in US. So let me know who you are. I understand it should be very late in Nigeria. So it should be probably around either 10 o'clock or 9 o'clock in Nigeria. So most of our weekend clinics normally come up about 5 p.m. But we had a couple of meetings today, so I couldn't meet up with 5 p.m. But every weekend, you will have an opportunity to have a word round. So please, when you come in, let me know who you are. Please introduce yourself. Admin will soon join. Admin will share the link. Admin will share the YouTube link, the page link, the group link. Make sure you join. There is no day you will show up and you won't learn something new. So please let me know where you're located. Once we have the number 50, I'm going to start. You will have an opportunity to ask me questions back and forth. The clinic is going to last for 45 minutes. So 45 minutes will be an opportunity for you to get feedbacks. Now, remember that the month of May, it's month of multiples. So if you're believing God to become a mother, if you're believing God to become a father, you can become a father of more than one baby. So you can have twins, you can have triplets, you can have quadruplets, especially if you're above 35. So you might have had long-term infertility. Your infertility can be primary, your infertility can be secondary. It's possible you've never been pregnant in your life, but when you become pregnant, if you can challenge yourself, if you can come out from your comfort zone, you can have multiple pregnancy. Any woman out there can succeed in having more than one baby at a time. And I will tell you the truth. If I'm in your shoes, I will prefer to do this once and for all. So you can complete your family in one sweep. You can step up and take that bold step, and you can suddenly complete your family by having 2, by having 3, by having 4. It can happen. It's possible, but you need to challenge yourself. especially if you are above 35. So if you're getting older, you have an advantage. Okay, so let's see who is in attendance this evening. I just need you to introduce yourself. Let me know where you're located. And as soon as possible, we're going to start the clinic. I have 6 more people to join before I open the clinic, and you can ask all your questions. So let me see who is in attendance. Let's see. Princess from US, Maryland, Lydia from Germany, Ejike from Delta, Judith from Spain, Idori from Akwa Ibom, Blessing from Owerri, Tosin from Germany, Amara from Kano, Jenny from Lagos, Lawa from Nigeria, Maisi from Germany, Zoba from Canada, Bisi from Houston. Thank you guys for coming. Please, when you come in, let me know who you are. Let me know where you're located. It's very important. Nana from Ghana, Adebayo from Germany, Mandy from Bayelsa. Admin just joined, so follow the admin. Admin is going to share all the links on how you can join our group. Remember, you can join the group, you can join the page, then you can join the YouTube. Then if you're my friend in Facebook, you also have an opportunity to get feedbacks. These are free services, free life-changing services. So in the next 45 minutes, you will have a feedback that will kick you into action. Now, the registration for the Super Masterclass on multiple pregnancy is on. The registration is going to take care of only 100 people. So I will encourage you to go and register today. We have 2 subject matter specialists, and they also happen to be females, and they also happen to be female-trained Nigerian doctors. One is in America here, one is in Nigeria. You will have opportunity to listen to us, and you will have an opportunity to take your bold steps. I encourage you to come out from your comfort zone. If you are courageous enough, you can have twins, you can have triplets, you can have quadruplets, and suddenly your family will be completed. So let's start. We actually have the number. We are 62 in number. So let me quickly, Dr. Ndiche joined from Kano, Lillian from South Africa, Stella from Lagos, Okezie from Oka, Farida from Abuja, my COO from New York, Kenneth from New York, Lucy from Nigeria, Peki from Port Harcourt, Nenya from Lagos, Njoko from Spain, Vet from UK. So guys, the clinic is open. Go ahead and ask your questions. I don't have a topic, so you ask me questions, I give you feedbacks, then you go home and you do the right things. Now, the motto of the group is PPP. The first P is praying. We pray a lot. We are God-loving people. We give everything to God, and we allow God to be God. Then when you allow God to be God, you have to go back and do your own part. So we pray a lot. Now, when we've done our prayers, we make love a lot. This is the love-making group. Every 48 hours, so long as you're not bleeding, you keep on making love. Now, if you have to make love every 48 hours, you have to know how to make love. You have to enjoy your lovemaking. So don't just be making love for lovemaking sake. When you're making love, enjoy your lovemaking, and before you blink, you will become pregnant. I can guarantee you that. Okay, so guys, follow the admin, click on the page, click on the group, join the YouTube, make sure you subscribe, like, and share with other people. But right now, the clinic is open, and please go ahead and ask your questions. It's open clinic. It's weekend ward round. Is it always the woman's fault when she is not pregnant? No, my sister. Pregnancy is a 50-50 journey. Pregnancy is not a destination. Pregnancy is a journey. So it's not the woman's fault. It's 50-50. The problem can come from the man. The problem can come from the woman. Now, how do we know? You have to see a fertility specialist. Unfortunately, if you're a Nigerian woman, the possibility that are blaming you for this infertility is 100%. Most men in Nigeria will blame the woman. The only way we can know where the problem is coming from is for both of you to see a fertility specialist. There are baseline investigations you must conduct to know where the problem is coming from. Now, even when we discover where the problem is coming from, a real man will not blame the woman. A real woman will not blame the man. It doesn't matter who the problem is coming from. It can be from the woman. The man should support the woman. It can be from the man. The woman should support the man until you become pregnant. Pregnancy cannot be achieved if it's only one person that is interested. Both parties must present to the clinic. Both parties must go for all their tests. Unfortunately, in Nigeria, most men refuse to go for their seminal fluid analysis. Now, you can have so many kids last year, and you can be using it to blame your woman. You can have low sperm count in this year. The same thing is applicable to women. You might have had so many kids in the past, but currently you develop some problems. It's called secondary infertility. So when you are going through infertility, remember that infertility is described as the inability to succeed in becoming pregnant within a period of 1 year. Now, we modified it for women above 35. If you're 35, it's no longer 1 year, it's 6 months. So if you are making love every 48 hours with your partner, you are 35 years and above. At the 6th month, if pregnancy is not achieved, you have infertility. What do you do when you have infertility? You seek help. Who is the best person to help you? A fertility specialist. Now, if you're below 35, 1 year, 6 months is for people above, 12 months is for people below, 35 is the cutoff point. Why is 35 an important age in a woman's life? Because above 35, you are classified as advanced. Advanced means your chances are reduced. It doesn't mean you can't get pregnant. You can get pregnant, but your chances are reduced. So you must be wise. There is no room for speculation. There is no room for assumption. If you're looking for a baby, you have to look for a baby the right way. I can categorically tell you the people that will become mothers by ending of this year and first quarter of next year. Do you know who they are? Women that practice PPP. The first P is the ultimate, praying to God, but you have to make love around the clock. You can't be in the guest room and your partner is in the main room and you're complaining you don't have a baby. You can't be making love only when you think you're ovulating and you're complaining you don't have a baby. You are shortchanging yourself. You have to make yourself available to meet with your partner regularly. Whether you know your ovulation or not, whether you know your fertility window or not, whether you have increase in your cervical mucus, it doesn't matter, regardless of the treatment you're going for. Even if you're shopping for money for IVF, even if you're shopping for money for IUI, don't stop your love making. There are so many women that will become pregnant even when they are shopping for money to go for special treatment. It has happened before. Your case can be the next. Okay, so let's continue, guys. Keep asking your questions. Also, the moderator is in the house, so we have a full house. Dr. Ndiche is in the house. Chief Operating Officer Kene is in the house. Then Chi Evelyn is in the house. So we have a full house to attend to you this evening. But please ask your question. Is it a must that a woman is above 35 to advise to give? Not your questions are confusing, my dear. You know, when you don't ask me a straightforward, simple question, you will confuse me. So let me see if I can make head and tail of your question. Is it a must that a woman is above 35 and advised to naturally? Okay, now let me just make it simple. The route you're going to deliver your baby is dependent on the baby, the presentation of your baby. If your baby is coming through the head, which is called cephalic, the likelihood you're going to deliver vaginally, it's high, is there. If your baby doesn't turn before 36 weeks, if your baby is breached by 36 weeks, the likelihood you're going to have CS is very high. Now, some women will also have some factors that will warrant them to go for elective CS. Now, if CS is the method of delivery, please go for it. The younger you are, the more likelihood you're going to have vaginal delivery. But there are still some younger women that will have CS. Please do not stand on your own understanding and insist on having vaginal delivery when it's not favorable. There are some women we can't allow to go into labor. The key outcome in all pregnancies is to have the mother alive, is to have the baby alive, is to have the father alive. Until the placenta is delivered, pregnancy has not ended. So the method of delivery is for the doctor to determine. This is the reason you have to go for your ANC. Most babies can assume any position before 36 weeks, but the position your baby will assume beyond 36 weeks will be the likely position that will determine the method of delivery. Now, listen to me. Please, if you've had CS delivery for 3 times, stop right there. We don't encourage women to go for more than 3 CS. Now, included in this operative procedure is your myomectomy. So if you've had any procedure done inside your womb, it's also counted. So unfortunately or fortunately, if you have had myomectomy is the surgical removal of your fibroid. It's also counted as CS, because in myomectomy, we are opening you up and we are removing fibroid, whereas in CS, we are opening you up and we are removing your baby. So anytime you've had surgical procedure in your womb up to 3 times, please don't go for the 4th procedure. Why? The likelihood you're going to have complication is very high, including womb rupture, including death, including extreme bleeding, because your womb needs to recover. Now, also, if you are a new mother, please give yourself a break. Allow your body to recover. Allow your womb to recover. Do not become pregnant immediately. Allow at least 18 months before you think of delivering another baby. One of the most important advice we give women before they go home after delivery is what? Contraceptive. Some women will start ovulating even before their bleeding comes. Some women might be in pain, but they might have high libido. Their partner can quickly, suddenly start making love to them. So before you know it, your baby is 3 months and you're pregnant again. I don't think it's fair to yourself, to your baby, and the new baby you have. So please, all pregnancies must be planned. Give your body a break. When you are giving birth to a baby, there are so many things you need to replenish in your body. There are so many nutrients you've lost. There are so many blood you've lost. There are so many damages in your womb. You need to give yourself a break. Please, I want you to be around to see your babies. I want you to train them. I don't want any stranger training your baby. So the way you go about having babies is very important. You need to be in good health to look after your baby. Nobody can look after your baby better than you. Okay, so let's continue, guys. Let's continue. Keep asking your questions. Remember, it's word round. What causes scanty and shorter menstruation? Couple of factors. Age, hormone imbalance, thin endometrium, couple of other external things people use. So I will tell you this. When you begin to take your oral contraceptive pills incessantly, when you begin to take your Clomid, because your friends told you, you are actually altering the cover of your womb, which is called the endometrium. So the endometrium is a very big determining factor of if you're going to get pregnant, if you're going to have miscarriage, if implantation is going to succeed. So please be careful. If your doctor didn't give you any drugs, especially hormonal drugs, please don't take them. So if you're in the habit of taking Clomid, stop today. Clomid can change a whole lot of things in your body, including probably setting you up to developing cancer. So stop. So your age is important. Couple of other gynecological issues, hormone imbalance, weight gain, weight loss, they can all affect the quality of your bleeding. Now, for you to know if you're having scanty bleeding or not, you have to know the normal. So every woman out there is expected to know their cycle. So the cycle is the interval between your 2 bleeding months. So every woman in our gathering should know if your cycle is normal. Your normal cycle is 21 to 35 days. How do you know your cycle? If you bled on the 15th of April and you bled again this month, today is the 8th. If you bleed today, check the number of days between the 15th of April and today. The number of days is going to give you your cycle. Now, if you can track that at least for a period of 6 months, you can see a pattern. Now, the duration of your bleeding is 2 to 7 days. So long as you're bleeding fully for 2 days is the lower limit of normal. So long as you're bleeding up to 7 days is the upper limit of normal. If you begin to bleed more than 7 days, let's say 8 days or 9 days is abnormal. You need to see a gynecologist. If you're only bleeding for 1 day, you also need to see a gynecologist. Very important. Pay attention to your body. This is why you need to be healthy, because the body of a woman works as a conduit. Anything that affects any part of your body can affect your ability to become pregnant. So you must be careful. You must look after yourself. You must eat good food. You must avoid stress. You must sleep. You must drink water. You must just be ready to be a mother. A real mother is a mother before she becomes pregnant and have a baby. So your lifestyle is very important. Okay, so guys, keep asking your questions. The admin just posted the links for the roundtable for the multiple pregnancy masterclass. Please register for this multiple pregnancy masterclass. Registration started yesterday. Slots are gradually being filled. We only have 100 slots. This class can change your life. This class can give you multiple pregnancy. You might suddenly from having no baby to having 2 babies. You might suddenly from having no babies to having 3 babies, to having 4 babies. It's not magic, my people. It's called faith. So you can step up and you can go for IVF and you can go for surrogacy and you can go for fertility treatment, and suddenly you can have 2 babies. You can have your boys and girls. You can have the family you've ever wanted. You can have your 2 boys, you can have your 2 girls, and that might be the end of the discussion. And some people that also want gender selection, you can actually have the gender you want, but you have to be ready. It's not cheap. But I challenge you to take your bold steps today. Join hands. Let's defeat infertility. I don't want anybody in this group showing up 2022 complaining about infertility. We want to banish infertility in 2021. Now, if God gave you life in 2020, which was a deadly year, God has a purpose for you. But please listen to me carefully. God is not going to come down to walk your walk. God has shown you the way. Your biggest prayer is to ask God to please show me the right group. Show me the right doctor. Show me the right provider. Show me the right person that will show me the right way to have my family. Not all women will have their babies naturally. Some women will have their babies through IVF. Some women will have their babies through IUI. Some are going to adopt. Some are going to go for donor egg. Some are going to go for donor sperm. Some are going to go for surrogacy. There are so many ways you can become a mother. Don't get stuck in one way. Unfortunately, my people, listen to me carefully. Some women might end up not having a baby. The choice is yours. Look, I'm telling you my truth. If you are above 35 and you're not taking your chance, my sister, listen to me carefully. You might end up not having a baby. Do you know why? You have a stipulated number of eggs. This is no joke. I'm not saying this to make you afraid. I'm saying this to wake you up. Once your eggs are done, they are done. Once you enter menopause, you are done. You can still become a mother if you use donor eggs, but the possibility of a Nigerian woman who doesn't even believe in assisted reproductive technique to even talk about donor eggs is limited. So if you are this heaven-bound Christian who doesn't believe in any help, you might end up still being a heaven-bound Christian and you will spend the rest of your life alone. I'm telling you this because I've seen it happen. So if you are 35 today, I want to challenge you to come out from your comfort zone and go above and beyond. The first person you need is a fertility specialist. When you book your appointment, you go with your partner. I ask a lot of questions. If you're under me, I ask about 27 questions. When I'm asking you questions, each question I'm asking you is going to help me to determine the kind of problems you have. Now, I have seasoned, reliable providers in Nigeria. Admin is going to list them. If you have a need, and if I refer you, if I tell you to go to Lagos, please go there. If I tell you to go to Oka, please go there. If I tell you to go to Abuja, please go there. This morning, I got a very good news. One of our members who failed 4 times in IVF, 4, very painful, very expensive. She succeeded with our Lagos provider in having good outcome. Now, let me tell you what you need to do. Please, once you are pregnant, don't be smart about your pregnancy. Don't be wise. Please register for ANC. I have noticed a trend. Some of our very hardworking women will become pregnant after a long time and they won't go for their ANC. They want to walk through the ropes. They want to tiptoe into becoming a mother. 9 months is a long time. So the very first thing, when you are announcing your testimony to me, please transition to ANC. It's important. You cannot afford to take this chance. Please, I'm practically begging you. A good mother will protect her baby. The first line of protection is ANC because anything can happen during your pregnancy, especially during the first 3 months, which is called the first trimester. So please, if you're hearing my voice this night and you're not in ANC, you're not doing the right thing. I'm telling you the truth. We need to make sure your baby is developing okay. Okay, so let's continue. Keep asking your questions. If your questions are not answered, it's possible I'm taking care of some other person's question. Someone with ovarian cyst, with fibroid inside on the right ovary, what should be done? If your ovarian cyst is symptomatic, if it's big enough, thankfully most ovarian cysts are functional cysts, they won't affect your fertility. Please, you need to go for cystectomy. So surgical removal of the cyst, and you will still have everything back. Now, anything that affects the functionality of your ovaries can affect your ovulation. Okay, so I will advise you to, and also you have fibroids, so we need to know the type of fibroid you have. The two types of fibroid we worry about is the intramural and the submucosal, especially if they're bigger than 5 cm. We need to remove them. No woman should go for IVF with big fibroid. No woman should become pregnant with big fibroid, because when you become pregnant, it's gonna cause a lot of problems. Some people won't even become pregnant with fibroid. So if you're diagnosed of fibroid and it's the two types I mentioned, intramural or submucosal, please plan and remove them. But this is what you need to do. I'm sure you heard the stories making rounds in Nigeria about the lady that died. What we do in this group, I will rather send you to a place I know I have confidence. Confidence cannot be 100%, but I'm a very, very, very particular person. This is why you won't see me giving anybody drugs. You cannot see me because I observe due process. So when you are going for a procedure, please do your due diligence. Make sure you're using the best. And make sure you go for that procedure on time. Unfortunately, some people can be told they have fibroid. They won't go for that fibroid surgery until the fibroid becomes very big. My sister, listen to me carefully. When your fibroid is very big, some doctors will not even accept to operate on you. When your fibroid begins to become big, they will occupy a very big space in your womb. Some of them will even damage your womb, that the only thing left is to remove your womb. And when you're going for any surgery, please make sure you're going for the best. Don't compromise standards. Let's do our own part so that God will do the remaining part. Surgeries are very, very, very carefully done thing. You don't just take yourself to anybody and they open you up. So you need to be wise. Okay? Okay. What can one do if one is having unexplained infertility? You go for IVF right there. So in unexplained infertility, if we have carefully checked you and you're okay, and we've carefully checked your partner and your partner is okay, after 1 year, please go for IVF. Don't waste time. Because in unexplained infertility, we've ruled out all the factors, so we don't know why. So I wouldn't expect you to be wasting time. You go for assisted reproductive technique as soon as possible. You can actually try IUI, but personally, I love going for IVF because, IVF is more superior. Okay, let's continue, guys. Let's see what we have. Okay. You've had 2 blighted ovum in a row. What do you do before trying again? Unfortunately, blighted ovum is something that needed to happen. It needed to happen. It's caused by chromosomal problems. So there is no way you can prevent that. But what I would ask you to do, when you've had this, it's very painful to happen to you. And especially you said it's happened twice in a row. So my prayer is that it's not going to happen again. But you need to take care of you. So you need to make sure you're ready. You need to make sure you're exercising. You need to make sure you're eating a lot of good food. You need to take your multivitamins. Then you need to have a fertility specialist. Okay? Now, there is nothing you can do to avoid having any problem related to chromosomal problems. In your blighted ovum, for some reason, when the mother is bringing his genetic material, when the father is bringing the genetic material, they had a problem. So there was a kind of an accident somewhere. So the complete set didn't form, and you had an empty sac. Okay, unfortunately, it happens. So that's what you need to do. Okay, and thankfully you have 2 boys. So what you need to do is to take time, make sure you're fully recovered, use the services of a fertility specialist, make sure you're exercising, make sure you're taking your prenatal multivitamin, and you go again, and by the grace of God, you're going to be a mother again. You have a very painful abdominal pain, not attending and not ovulating. What could it be? So pain is a non-specific sign. So I can't tell you that this pain is because of this, because pain can mean infection, it can mean inflammation, it can mean fibroid, it can mean other gynecological issues. So what I will advise you to do is to see a gynecologist. And also, you said you're not ovulating. How do you know you're not ovulating? It's only a gynecologist that can run some tests and tell you you're not ovulating. So you need to see a gynecologist. Okay? So guys, I should have about 15 more minutes. So keep asking your questions. If your husband lives and works abroad and the wife lives in Nigeria, how can that achieve? The next time your husband comes, take your husband to a fertility specialist. We can freeze his sperm and you guys can go for IVF. Distance should not be a problem. We can store your eggs. We can store your partner's sperm and we can use it in your partner's absence. So let me give you an example. Your partner lives in America and he's not able to come back again because of papers, right? The last time he comes, please go to a good fertility specialist. We're going to collect his sperm. If his sperm is good enough, we're going to collect the sperm. We're going to put it in a bank. We're going to preserve the sperm. Then when you're ready, we're going to make sure you have good eggs and you can go for IVF. You can actually complete your family in your husband's absence. Yes, it's possible. Okay. Now, in some centers, if your husband is in America and you're in Nigeria, there are provisions for some clinics to transport the sperm back to Nigeria, and we can also use that. So you need help. Standard getting help from getting a subscription, then we refer you to a fertility specialist. That's what you need. Okay, guys, keep asking your questions, please. Remember, if you want to talk to me, it's possible. So you can subscribe. You can come in at 1 week for lives. You can come in at 1 month. You can come in at 3 months. You can come in at 6 months. Now, of the packages, the only 2 packages that will give you opportunity to talk to me on phone one-on-one, even with your partner, it's the Prime, which is 6 months, and the Classic, which is 3 months. When you subscribe for that, we can have monthly. So for people that have Classic, you have 3 opportunities to talk to me. So we can schedule the call. I can talk to you. I can talk to your partner, and we can find a common ground. When you have 6 months, you have 6 opportunities to talk to me. But if you're coming in with light or basic, you're just going to be interacting with me until we get help. Everybody that subscribes will have an opportunity to get referral. My providers in Nigeria are people I trust, people I correspond with, people we can co-manage, because the problem is this. Unfortunately, some of our providers in Nigeria, they don't like interacting with people. They don't share your medical report. They don't tell you what's going on. But when I ask questions with my providers, I get feedbacks because I want you to have your good outcome. I want everybody to have their baby. I'm a father, I'm a son, I'm a husband. I know what it means to have your own kids. So I want you to succeed. Okay, so that's why I want to send you to the best place. Okay. Okay, any question related to calculating your ovulation, admin is going to set you up for that. I'm not going to teach that for today. Okay, so guys, continue asking your questions. Let's see what we have. Okay. They referred you to do hormone profile, but your progesterone was so high. What can you do? You go back. Anytime your hormones are either high or low, we need to correct that. So you go back to the doctor that referred you, and the doctor will correct that, okay? What can cause right breast pain 10 days before period? So if you notice this, if you notice this pattern of pain 10 days, about that 10 days before your period is actually the period you might be ovulating. So this might be a sign you're ovulating. If you pay attention to your body, you will notice that this particular period, your breast is very heavy. It's just all the cyclical things that happen in the body of a woman. It's hormone related. There is nothing wrong with it. But if this pain you're having in your breast is a new development and it's not in a particular time of your cycle, then you need to see a gynecologist. Okay? But if it's something that happens about this time you mentioned, every 10 days before your period, that's likelihood the period you're ovulating. Okay? Correct. Sperm can be transported from anywhere to Nigeria, and you can go for IVF and you can have good outcome. Okay, guys, keep asking your questions. You're 13 weeks pregnant. So first of all, if you're 13 weeks pregnant, are you in our ANC group? And you still feel pain and sometimes left, right, up, down, and it comes and goes, and scan says everything is fine. So it's not unusual to have little pain and nicks here and there. When the baby is expanding, they can put pressure on what we call ligaments. So you can have ligamentous pain. It might be gas, it might be inflammation, it might be infection. So since we've done the scan and everything is good, and you vomit yellowish stuff, most women that are pregnant are going to vomit. So I'm not worried about that. But what I will advise you to do is to go and register for the ANC immediately. Any woman listening to me this evening, please go and register for the ANC. Admin, please send the details of ANC registration to Jenny Obo. Please follow through. Don't play smart with your baby. The biggest place to invest your money right now is in your family. If you have millions stacked in your bank, in your investment, in your cars, in your homes, but you haven't invested in starting your family, you are actually not wise. The biggest thing to invest in 2021 is your family. If it's going to take 10 million naira to start your family and complete your family, go and do that. That would be the biggest wealth. Don't have millions lying about. At the end of the year, you're going to throw a big party. You're going to go fashionably. You're going to go impress people that don't even like you. Use that money and start your family. Go for the best. Don't compromise standards. Unfortunately, infertility treatment is expensive, but we are making it easy for everybody. What we do in this group, you can't put monetary value on it. The daily information we share in this group, there is no amount of millions you can pay to be equivalent to the what. So use your resources to get help. If you're in Lagos, go to the best fertility specialist in Lagos. If you're in Oka, go to the best fertility specialist in Oka. And whatever we tell you to do it. Unfortunately, infertility treatment is expensive globally. Very, very expensive. But if that's the only thing you succeeded in doing as a human being, you're the wealthiest. Nobody can compare to you. Must you go through laparoscopy before IVF? Not a must, but if your provider feels the need for it, please go for it. So when you're going for laparoscopy, we are having an extensive look inside the womb, and anything that will impede our outcome, we can remove it. Okay? So the areas we have providers, if you're living around about that area, is Abuja, Asaba, Oka, Benue, Calabar, Enugu, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, Owerri, Port Harcourt. So if you live in any of these neighborhoods, we can refer you. If you're not living there, if you need to travel to go there, please go. Distance should not be a problem. Okay. Guys, let's continue. Let's continue, guys. Let's continue, guys. I think my daughter or either my wife or my mother-in-law is attending. I can see Chizara's world. It can't be Zara. Zara is not on Facebook. Okay, guys. Okay, it's possible Zara is doing her stuff, but that's by the way, guys. Okay. Let's continue, guys. Keep asking your questions. Can a woman that has high prolactin and LH go for IUI? So first of all, before you go for any procedure, before you go for any treatment, we need to know your hormone profile, right? So we need to look at all the reproductive hormones. We need to look at estrogen. We need to look at progesterone. We need to look at LH. We need to look at FSH. We need to look at prolactin. Anyone that is not within the normal range. So if you notice, if you pay attention, when they send you to lab, look at those numbers in bracket. Let me give you an example. If they are checking your prolactin and your number is 100, but in the bracket, the normal range is 80 to 200, and your number is 100. Is 100 contained from 80 to 200? Yes. So 100 is normal, right? Now, if your number is 400 and the normal is 80 to 100, 400 is above 100. So that means your prolactin level is high. So we need to correct all known hormone problems before you go for any procedure. So if you're going for IUI, one of the criteria for IUI is to make sure at least one tube is open. If you're going for IUI with blocked tube, you're wasting your time. So we need to correct the prolactin problem. Thankfully, prolactin problems can be corrected. There are some drugs we can give you and we can take care of the prolactin problems, okay? When your tube is twisted around the ovary, but the dye spelled freely during dye test, can egg pass freely in such tube? Well, anything that affects the integrity of your tube is already compromised. That's a fact. Anything that affects the free opening of your tubes, like in your situation, the fact is twisting around the ovary is already a problem. I can guarantee you're already in pains. So we need to correct that. Okay? All right. How does a 45-year-old woman with a man achieve? Let me read your question again. How does a woman of 45 years without a man become pregnant? It's a choice. The choice is yours, because without a man, you can't become pregnant. And you're 45. So the question becomes, can you go for it alone? Do you want to go for it alone? Because without making love, you can't become pregnant. So if you are in this side of the world, you can go for IVF. You can use donor sperm and you can have your baby. You can adopt. So you can't become pregnant without a man, naturally. So I will leave that for you to decide, because I can't come in and decide for you. But remember, you're 45. So at 45, you're nearing your menopause. So at this 45, we check your eggs are definitely reduced and are also of poor quality. So you need to decide and do what you need to do. So guys, I have 5 more minutes before I wrap up. 5 more minutes. Yeah, she have already attended to the breast pain. It's likely related to her cycle, which is not a problem to me. Okay, guys, let's see. Is there any problem? Your period comes just for 2 days. 2 days is the lower limit of normal. There is no problem. Okay. Okay. Painful nipples when not pregnant, just hormonal changes. Hormonal changes. You should just endure that. That's no problem. What's the detail about the masterclass? Chi, please share the links for the registration of the multiple pregnancy with Jimo Fatima. Please, 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 please. I know so many of you love babies, right? And you love, how many people? Let's do this. How many people want to have more than 2 babies in 2022? Because if you're not pregnant now, if you become pregnant, likelihood you're going to deliver in 2022. If you want to have multiple pregnancy, please indicate. You know, it's one thing to say you want to. It's another thing to acquire the knowledge and change your attitude and your practices. So what do you have to lose? There are so many things we spend money on, which doesn't even matter. But the things you need to spend money on, you don't spend money on it. Is 3,000 naira too big to invest in your family? To start your family, to end your infertility? Is it too big? No, if you ask me. It's actually nothing if you can afford it. I understand some people might not afford it. Most months, some people raise money and, you know, we invite people that can afford it. But if you know you can afford it, step up and take your bold step. Move beyond your comfort zone. Look, I'm telling you this because I know. There are so many women that will have twins after this class. There are so many women that will have triplets after this roundtable. There are so many women that will have quadruplets after this roundtable. It will happen. I was very happy when my client from Maryland that went to Nigeria, she's in menopause, but she decided to go for donor eggs so she can start her family. So even in your menopause, you can still be a mother. No matter your condition, you can be a mother. But the decision is on you. And this is where knowledge can come in. If you begin to go to the same people that have been deceiving you, they can be deceiving you and you won't even know you're getting old. Before you blink, you're 70. And by the time you're 70, they would have died. The people that have been deceiving you will die and you'll be the only person. God didn't make any woman to be alone. So step up. Don't allow anybody to deceive you again. Start with adoption. Adopted babies bring good luck. Okay? Okay, so guys, my time is up. I believe I have 2 more minutes. So let me quickly see if I have any other outstanding question. Then I'm going to go for the day. Remember, tomorrow is my maternal and child health clinic. So we're going to find a good topic. And we're going to talk about it tomorrow. Okay. Thank you so much, Dr. Ndiche, for providing feedbacks. Can every vaginal itching caused by infection, especially during pregnancy? If you have vaginal itching during pregnancy, when you go for your ANC, you complain to your provider and we'll see what we can do for you. Don't use anything that your doctor didn't give you. The fact you're having vaginal itching can mean a lot of things. It might be allergy, it might be infection, it might be inflammation, it can be hormonal, it can be a whole lot of things. Okay? What can be done when the scan says irregular gestational sac? Well, we need to go for repeat scan, and hopefully then they can pick up the sac. Anytime we don't have a well-defined sac, depending on the week of the pregnancy, it's likely you might have what we call blighted ovum, or you might have missed abortion. We need to see the sac. So the clinical evidence of pregnancy is ultrasound. We need to see that that baby is developing inside the womb in a sac and a pole. So you need to go for a repeat test. So 1 more minute, guys, then we're done. 1 more minute. Anything that affects the way the tube is originally meant to be can affect the function of the tube. So if your tubes are twisted, the likelihood that that tube is blocked is very high. Okay? Can a baby born at 35 weeks without any issue or complications? So if your baby is 35 weeks, your baby is 2 weeks before term. So all babies that are born before 37 weeks are called preterm baby. So we'll take your baby to the NICU and we'll monitor your baby and your baby will be fine. My daughter was born at 26 weeks. So that will tell you a whole long way Zara went before she went home. Okay, so guys, thank you for coming. My time is up. Let me quickly see if there is any other outstanding issue. So if I didn't attend to your question, I apologize. Hopefully tomorrow I will have an opportunity to attend to everybody's questions. So thank you so much. I believe Dr. Ndiche is also, so many people are indicating interest that they want to have multiple pregnancy. Why don't you take your bold step? Why are so many of you not prioritizing what you want? Do you understand what they call faith? Where are you putting your treasure? Where are you putting your resources? I'm telling you today that you can end your infertility. I'm not joking about this. You can. It might be 20 years. It might be 15 years. And suddenly, you can have your twins, koro, in your eyes. You can have your triplets in your very eyes. Even quadruplets. It has happened before. So I challenge you to come out from your comfort zone and take your bold step. When you register for the class, we're going to share our knowledge with you. You're going to go take your bold step. So many people are going to step up to go and do their IVF. And it will happen in your own eyes. And you'll be like other women. There is absolutely nothing wrong with you. Okay, so guys, hold on. Okay, thank you for coming. My time is up. I have to go now. I appreciate you guys. I love you guys. Please keep on practicing your PPP. Your PPP is the biggest weapon against infertility. I believe that all women who attended today, so many of you started there, only 81 people stayed back. By this time next year, you are gonna testify. By this time next year, you will mount this stage. I will announce your baby. I will announce your babies in this group. I will announce your twins. I will announce your triplets. I will announce your quadruplets. I know this for sure because that's God's promises. But you need to move. God cannot move you unless you move yourself. Thank you for coming, and God bless you. And, we love God. We say a lot of amen. When you have said amen this evening, go and register for that class before it hits 100. Once it gets to 100, I'm going to close the class. This class can change your life. This class has changed so many lives. It's a class I love teaching. If you have been following me, since 2015, we've been having fun. Every singular woman in attendance this evening, if you dare to take your bold step, you're going to become. I'm challenging you. God bless you and enjoy the rest of your evening. Bye-bye for now. God bless.